Good morning, good morning, good morning, and welcome to the Great Lakes Health Radio program on Power 96.5 FM, WUFO AM 1080. I'm your host, Francesca Messiah from Kaleida Health, Manager of Workforce Development. And I always give an overview of who is Kaleida Health. Kaleida Health, we're the hospitals. This is just to name a few. We're Buffalo General Medical Center. We're Millard Fillmore Suburban, Oshai Children's Hospital, Gates Vascular Institute, the Visiting Nursing Association, which it makes home visits and does home type of services, medical services, 24 hours a day, 7 days a week. We're High Point at Michigan, providing long-term care, skilled nursing facility. Also, DeGraff, also providing DeGraff in Niagara County, provides skilled nursing facilities. And we also have DeGraff Medical Park for your emergency needs. We have Olean General Hospital in Olean, New York, Bradford Hospital in Bradford, Pennsylvania, and we have clinics located throughout all of the areas where we have hospitals. And we have services from newborns to our oldest patient. And I'm going to take a guess, might be around 125 years old. I want to thank you for listening to our program. And today's program, well, you know what today is? Today is the Juneteenth festival at Martin Luther King Park. Matter of fact, it is the 50th. We're celebrating Buffalo, New York has the second oldest Juneteenth in the country. And this year we're celebrating 50 years. And for the past maybe 18 years, Kaleida Health and Erie County Medical Center, ECMC, have shared the Health Pavilion. And on that note, I'm going to introduce you to our guest today. And that is my esteemed colleague, who I always mention at the end of the show, but she's on the show today. And that's Cindy Bass. Good morning, Cindy.
Good morning, Fran. Thank you so much for having me on your show.
Oh, you're welcome. And Cindy is the Chief Diversity Officer at Erie County Medical Center, ECMC. And we have her colleague, Natalie. Natalie, say your last name for me, please.
Wasico.
Natalie Wasico, who is the operating manager, part of the Office of Diversity, Equity, and Inclusion at ECMC. And you know what? On that note, I'm proud to say both Kaleida Health and Erie ECMC, Erie County Medical Center, we each have our own Office of Diversity, Equity, and Inclusion. Woo-hoo.
Yes.
Just had to say that. And this interview is going to be Cindy, Natalie, and myself, because we've been talking for, oh my gosh, at least the past 8 to 10 years on the health pavilion at Juneteenth. So you're going to hear me chiming in on part of this conversation. So on that note, I've already mentioned part of the significance of Juneteenth. It's 50 years in Buffalo. But what Juneteenth did and why it's called Teenth is because we were enslaved. I'm African American, if you didn't know. For over 400 years, we were enslaved.
Yeah.
And when we got our freedom, we couldn't pick up a phone and go from plantation to plantation. We had to go on a horse. Someone had to go on a horse from plantation to plantation. And it was during the month of June. So when people have a Juneteenth celebration, it took place in the teens of the month of June. So I just wanted to share that little bit of history. And Cindy or Natalie, do you have anything to add to the history?
Yeah, Fran, I just wanted to say, yes, it's really about our freedom that, like you said, was not communicating. They finally found out it's really a celebration. And, with the celebration comes just we celebrate and we have, that's the reason we have the parades and festivals. And have a good time with and all the cultures that come together. So it is a great celebration. We're looking for a great time today.
Yes, yes. And speaking of time, um, Natalie, what time is the health pavilion open?
Yes, of course. So the Health Pavilion is open throughout the day, and you will see us ready to go around 10 a.m. and we'll be there until 4 p.m. So it's really a nice span of time that you can come and stop by and learn a ton of information about taking care of your health, which is so important.
And I'm before I say anything, how can you best describe the location of the health pavilion?
Sure. So it's located right in the middle of the festival. So you'll see us, it's a big white tent, the Health Pavilion, with plenty of tables. A variety of health organizations will be underneath. And just for a specific location, Fran, you may be able to speak a little bit better towards that as far as the crossroads.
Yeah, and you know what? I have to tell you, that's exactly what I'm looking at, the
Mhm.
crossroads. So if you know where, listeners, if you know where the grandstand is, which is where the parade ends. So you know the parade starts over at the Juneteenth building. And if you know where the grandstand is, and here's the cross street, North Fillmore Avenue and East Park. So it's North Fillmore Avenue and East Park. That is the street that's closest to the Health Pavilion. If you look at the Health Pavilion, it does. Our names aren't always on there. However, you'll see tablecloths, and you'll see tablecloths that say Kaleida Health. You'll see tablecloths that say ECMC, and we're right in the front. And just ask someone, is this a health pavilion? What do you say, Cindy?
I say we're in the middle, right there on Fillmore Avenue, and we're right across, like you said, right in the center. And I said they said the center of Fillmore, but right near the pool area.
The pool, yes,
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 right in front of the pool area, you'll see the white tent, and you can find Kaleida Health and ECMC.
yes. And let's first talk about ECMC. What are some of the services health services that ECMC is providing, or literature? What kind of literature and or screenings will ECMC be providing?
Our population health team will be there talking about health education and chronic disease management. So they'll be promoting awareness and strategies for managing long-term health conditions. In addition to that, we'll have some resources about addressing non-medical factors that impact your health as well. I'm also really excited to share that we'll have our dental team there doing screenings. So
Yeah.
you can come and step on up and we'll screen you right on the spot there. Make sure that your teeth are healthy. We also will have information about mental health services, and our Center of Occupational and Environmental Medicine will be present.
Okay. And the dental screening, do you know around, I mean, only because I know that they've been there and I've seen them before. How long does it take to get a dental screening? What would you say?
It only takes a few minutes. It's really quick. And they'll provide you information there for a follow-up appointment and just to get in contact with them. So it really doesn't take long, and it's a great use of just a few minutes of your time.
Yes, and I have to say that, and they're the nicest staff because sometimes they're on the quote unquote ECMC side, and then their side of the tables, and sometimes they're on the Kaleida Health side of the tables. So you just ask, if you need a dental screening, um, they are great. They normally have swag to go with that along with the screenings, but it's just a really great way. Even if you have a question, if you have a question about your teeth, because ECMC has a dental clinic within the building, right?
That's correct. Yes, we do have it
Yes.
right on the first floor in our main hospital.
Yeah, no, that's great. Because we
Yes.
don't, no, that's because I know we don't have the dental service at Buffalo General. And and on the Buffalo General side, not Buffalo General, the Kaleida Health side, I know some of the services that we will be and information we'll be sharing. If anyone needs a primary care physician. I know sometimes the physicians retire or their practice moves out of town, but we have someone there who will be sharing information on if you need a new physician, and they'll sign you up right there. We're going to have our human resource department will be there, specifically from High Point recruiting for certified nursing assistants because I know at our site at DeGraff we have a training program for certified nursing assistants, but we're also just going to have information on getting jobs, how to apply for jobs, job information. We have family planning. Family planning, it's one of our departments. It's on Main Street. They have all types of information, not only on family planning, but we'll have information. If you think you may have a STD or STI, we'll have that information. We have our stroke department, which I know both of us have stroke departments of excellence. But Kaleida, I know we'll have our sharing information on that. And also liver disease. Liver disease is huge. And it's certain diseases, fatty liver. I know, I know there's a new name for that. Hepatitis C, HIV are still very prevalent in the African American community. And I know that there'll be someone there with information on testing and again, where you can go to be tested. Um, for ECMC, if will people be able to make appointments with any of your providers who will be there?
So we will have contact information so that you can make an appointment and either call or contact our clinic with the information that they provide. But we'll make sure that you're well equipped to do that, and we'll have plenty of supporting information so that you can take that next step.
Mhm. And when someone comes to the tent, let's say and I'm looking at the sign in my computer, and when someone comes to the tent, and let's say who else is under the tent? You have a group of nurses, right? The
NISNA, believe the NISNA, um, NISNA will be there. Usually the Brave program is usually there as well.
and what's the Brave program?
So the Brave program is for individuals that might have experienced violence in their from a
Yes.
family member or themselves, and they will be able to provide information of support, resources that are available to assist.
Yeah, and you know what? And we have a program thinking of specific programs. I just can't think of the name, but I know they'll be there.
Uh-huh.
Addressing youth, um, who, well, you know, addressing youth who may have been exposed to HIV, and also information for youth for along the LGBTQ. GBT. So I know we're going to also have that someone there to answer questions. But when you talk about, I don't even know why when you talked about violence and trauma, it just made me think about LGBTQ. And not that there is any violence or trauma, but the idea we're just talking about specific programs.
Yes,
Um,
and also, friend, along with the Brave program, I couldn't think of the name. The other program is Snug.
oh, Snug.
Yeah, Snug. They usually Snug and Brave work together, And I know last year they shared a table that was under our tent to give information for that. And along with that, you mentioned for the LGBTQ community, we will have, and I believe Natalie mentioned it, our Youth Center for Wellness. That's here in the main building. They will be there to provide information, and we hope to have some giveaways as well. So we're going to have lots of giveaways and informational that you can stop by the tables to receive.
And why do you know what, I again, I know I have my views and opinions. What I like about having the two of our departments, we have our tables right in front. We're right in front,
Yes.
and it's an assembly line, and
Yes.
and we rarely have any overlap. How does that happen? We rarely have overlap.
Because we work so well together and we organize it.
We
And Natalie, being the operation, I mean, the three of us, we just come together. We know our purpose, we know the goal, the objective we're trying to achieve, and we make it happen. So there's not an overlap, and I always say communication is key. So we communicate with one another because we want to be able to provide the best resources to our community and to people who stop by our table.
Yes. Do you have anyone there from health insurance?
You mean like if a person is in need of help
Right. If
assistance?
someone needs a facilitated enroller, do you have and I'm just asking because I don't think we do,
No,
but
I don't think, because like if one of our patients need assistance, we have the financial counseling department, but I don't
right.
think we do have anybody. But that's a good point,
Yeah,
Fran.
and I know we don't have anyone, but I know by having someone from family planning and having someone from our Hurdle Elmwood department, I'm confident that they can answer the question if someone is in need of health insurance. So listeners, if you're in need of health insurance for your children, for yourself, for your, for your children or yourself, please again come to the Health Pavilion and that and speak with one of us. And under the Health Pavilion, how many vendors would you say are under the Health Pavilion?
Oh, wow.
Under the health pavilion,
Yeah.
I would
Oh,
say, wow, we
wow.
have a lot of vendors. And we make room, but I would say
Yeah.
maybe somewhere around 25, 30 vendors,
Yeah,
if I'm not mistaken.
Yes. That's
and
a
my
lot.
there's a lot, and my point being, just because we don't have it, I bet you one of the health insurance companies are probably going to be under the Health Pavilion
Yes.
Yes.
because we are just two organizations out of maybe, like you said, 25 who are under the Health Pavilion, and sometimes Juneteenth has two health pavilions.
Right. Oh,
So if you need any kind of health, service, stop first at ECMC with us, Kaleida Health and ACMC, and feel free to walk through the tent. So we have a small portion. We are sponsors, but there are at least what 20. There are rows, right? What you say?
yes. And tables
Yes.
behind us. So people in the center, people on the side. Yes, there's a
Just
lot
like
of
you said, Fran,
information.
like an assembly line, you could really go around the whole health pavilion and get tons
Yes.
of great information, brochures, giveaways, like Cindy said. It's really a great experience.
hmm hmm Yeah, and that's what I was thinking, and when you come to either the Kaleida end of the pavilion or the ECMC end, we encourage you to just stop and have a brief conversation with each of us, and it could take anywhere from 5 minutes or less or more if someone is addressing your needs. We are here for you. We are
Yeah.
here for the community. We are here to answer your questions, to listen to what you to listen to what you listen to what you want to share with us. Sunday now. Sundays. Are you there on Sundays? Is ECMC there on Sunday?
ECMC
No.
is there on Saturdays, so no to Sunday.
Yeah. And the same with us, the same with Kaleida Health. Although there are departments, and I always make my colleagues aware that if they are interested in coming on Sunday, and some departments do, some departments do return on Sunday because they say Sunday, well, because of the parade, Saturday is just a busier day,
Yeah.
you know. Are you set up before the parade? If someone is there at 10 o'clock in the morning and waiting to see someone walk down, come through the parade, are you set up before?
Yes, we will be ready to go. So if you wanted to stop by and then view the parade, it's actually a perfect spot to do so.
Yes.
We encourage that.
Yes, yes. Again, that's another idea in terms of where we are. I'm looking at the sign again, East Park and North Fillmore, but where it's a large tent in front of the parade. Um, there are probably what, at least 3 rows of people, you would say, set up who are watching the parade with their chairs.
Yeah,
Oh,
lots of people.
lots of people.
It's really nice too because we're close to a lot of the food vendors there. So you
Yes,
can
we
come
are.
and you can get something to eat, sit down, watch the parade, stop by the health pavilion, and really have a wonderful day today.
Mm-hmm. And I know we're going to have bags for your information. Are you going to have bags for people to put their information in?
Absolutely. You can count on us for that too.
Yes. Yeah. So I mean, we're there. I know we get there to set up things around 6 o'clock in the morning. And each of you, Cindy, Natalie, what motivates you for the Juneteenth for the health pavilion and to get there so early? What motivates you?
It's just the opportunity to connect with others and to celebrate such an important part of history. And coming together just for the health of our community to see how we can be assistance to others. It's always a beautiful day and just such a great experience. So for me, it's just being able to connect with people in our community, see how we can help them.
Yeah, and I'll say for me, just, I can remember as a younger person, me and my girlfriends walking to the Juneteenth. So it's just been a part of my life every year, part of my culture, that I have been a part. And now that I'm in the position that I am, and to be able to serve the community, and provide information, that our ECMC has so many services that a lot of people just don't know about, and we're growing. So, just like Natalie said, having the opportunity to provide that information and to provide resources to the community in which we serve. So that's very important. And Fran, I wanted to mention ECMC for the first time. I know under the Office of DEI, not mine, but the Office of DEI, we will be in the parade this year. So this is our first time doing this. So I'm very excited about that.
Yeah, and you know what? And I think it's Kaleida's first time in a long time. I'll say first time in a long time because I've only been
Uh-huh.
with the organization 20 years, and Juneteenth is 50 years old here in Buffalo. So I'll say the first time that I'm aware. I personally won't be in the parade, but I know that my colleagues will be will be in the parade. But again, and as Natalie said, we are set up normally by, I would say, 9 o'clock in the morning, ready to hand out information. You may want to come back because some of the departments may not have arrived as of yet. However, at 9 o'clock, you can begin stopping by the tent, and asking those health questions for you, for your loved ones, for your family. We're all about education. The more what are the one of the was it Cy Simpson said it, educated consumer is our best customer and educated patient is our best customer.
Yes.
That's right.
Yeah. Well, we only have a couple of minutes left. What would you, Natalie, Cindy, what would you like to share with our listeners?
ECMC would love to see you today. Stop by the Health Pavilion. We'd love to meet you and see how we can provide resources to you.
Yes, same as Natalie, we're just excited to be there. And we're excited to be able to share the information today, of services we have to provide. So we're excited and we want you to be excited and we want you to come and especially get the shopping bags because when you do your shopping across Juneteenth, you will be able to use our bags and just the Kaleida and ECMC bags. So we're just looking forward to seeing you on today.
And I'm going to say, I look forward to seeing you today and to steal a line from Frankie Beverly, Kaleida Health, ECMC. We are one. And at Juneteenth, the Health Pavilion, we are one. We want you to stop by. We want to hear any kind of comments you have about primary care. I'm really confident that we have someone there, not us personally, but we will have someone there under the Health Pavilion who can assist you, who can answer your question. I would say between the two of us, we probably have at least 15 different departments between the hours of 9 and 4 p.m. And they are able to there to answer your questions and to assist you. So, and on that note, I want to say thank you, Natalie. Thank you, Cindy. I look for, I'll see you within 24 hours under the Health Pavilion, and I want to see you, listeners. We want to see you under the Health Pavilion at the Juneteenth Festival. And again, there are about 20 other health organizations under the Health Pavilion, but please make your first stop with Kaleida Health and ECMC. Thank you for listening to the first half of the Great Lakes Health Radio program. And within 30 seconds, you'll hear this. You'll be listening to our second part of the show. Bye-bye. And now on to part two. Good morning, good morning, good morning. And thank you for either tuning in to the Great Lakes Health Radio program on Power 96.5 WUFO FM or WUFO AM. That's 1080. Or you might be listening through Google or another one of the search engines. But anyway, thank you for staying with us. I'm Francesca Messiah from Kaleida Health, Manager Workforce Development. And the second part of our show today, we're talking about fatty liver disease. The past few weeks, we've been talking about hepatitis C and HIV and their impact on the African American community, and very detailed. And we also want you to make sure you ask your physicians, your primary care physician or your nurse practitioner about getting making sure you get the blood work to make sure you don't have hepatitis C or HIV, or today what we're talking about, fatty liver disease. Well, our guests for today, two of our guests are not a stranger, and I'm still introducing them. We have Dr. Ken Snyder, who is a Chief Physician Quality Officer at Kaleida Health. Good morning, Dr. Snyder. How are you today?
Good morning, Francesca. Thank you once again for having me and for all you do for our community. Appreciate you.
Oh, you're welcome. And we have Dr. Talal, and Dr. Andrew Talal is a gastroenterologist and what is MPG, Dr. Talal?
So actually, Master in Public Health, MPH.
Oh, MPH. Okay, Master of Public Health. And he's also at Buffalo General Medical Center. As I said, he's a gastroenterologist.
Gastroenterologist. Thank you very much.
Thank you.
And also professor of medicine at the University of Buffalo.
And yes, thank you. And also professor of medicine at the University of Buffalo. And then new to our show, we have Dr. Daria. And Dr. Daria is a director of liver services. And Dr. Daria, are you at Buffalo General Medical Center?
I am at the University of Buffalo.
At the University of Buffalo. We're all in the same family. So thank you. And thank you for being our guest. And I want to thank all three of you, Dr. Snyder, Dr. Tallal, and Dr. Daria. Well, on with our topic. Our topic for today and our questions is fatty liver disease. Dr. Tallal, what is fatty liver disease? And for all of those who kind of forget from biology or chemistry, what is the purpose of the liver?
Thank you very much for the invitation to speak to you today. And it is indeed a pleasure to describe the liver for your audience, the organ for which I've been working the last 30 years. So really the purpose of the liver is multifactorial. So the liver filters blood to remove toxin and waste products. It produces nutrients for energy, produces bile to break down fats, serves as a storage site for many different types of body processes, including glucose, vitamins, iron, and also has other roles such as regulating proteins that are involved in blood clotting, maintaining blood sugar levels, and synthesizing proteins. And so it's really a very important organ and one that you really want to take care of. The second part of your question, or the first part, what metabolic syndrome is really a cluster of conditions that affect our metabolism. And we refer to these as a group of conditions that usually consist of diabetes, high cholesterol, high blood pressure, obesity, and high fat content within the liver. The term nowadays, very recently within the last 2 years, has been called MASLD, or the complicated term of metabolic dysfunction associated steatotic liver disease. And so it's really not related to dietary fat content, but is due to the fat produced within the liver. And what happens is that the fat is stored within the liver cells. It's not excreted, and a little fat in the liver cell is normal. But what happens in this situation is that the fat can really overtake the normal function of the liver. You can get inflammation, which can result in liver damage. Inflammation, being those cells that are meant to protect against an infection, can actually be recruited to the liver inappropriately and for reasons which we really don't understand. And in this situation, the inflammatory cells attack the liver, even though there's no infection. And over many years, this attack on the liver can overcome the liver's normal process, wound healing process, normal process of repairing itself, and can result in scarring that can result in cirrhosis. And I'm going to go on for just one more minute. Cirrhosis is what we call complete scarring of the liver and can be compensated or decompensated. In compensated cirrhosis, the liver is able to make the things that it should be making. In decompensated cirrhosis, the liver is not able to make the products that it should be making that I described earlier. And people who have decompensated cirrhosis can have thinking disturbances, fluid in their belly, and in their feet, easy bruising, easy bleeding, as well as other symptoms.
That is a lot. Okay. Wow. Yeah, thank you. Dr. Daria, what are the demographics for, I'm still going to call it fatty liver disease because that's what most of our listeners will remember at this point. Because what was the other term you used? MASLD?
MASLD. MASLD.
Okay, MASLD. So MASLD is also known as fatty liver disease. So Dr. Daria, what are the demographics in Western New York for persons with MASLD or formerly known as fatty liver disease, and who was at greatest risk of having MASLD, also known as fatty liver disease?
Hi, thank you for having me on your show. So
Oh, you're
I'll
welcome.
answer the second question before the first question. And the second question is, who is at the greatest risk of having MASLD? So as Dr. Talal was talking about metabolic syndrome, it's those people who have diabetes and obesity, they should be screened for MASLD because having two or three components of metabolic syndrome, it could mean that you actually have other components of metabolic syndrome as well. And since MASLD is one component of metabolic syndrome, it makes sense that you can have multiple components. Regarding the demographics, we often see many Hispanics and African Americans who can have MASLD, but it can also affect Caucasians as well. There has
Mhm.
there has been a gene that was identified in the Hispanic population that causes increased inflammation in the liver. So this is one reason why Hispanics are affected more than others.
And does this have anything? I mean, and this is either for Dr. Talal, Dr. Daria, Dr. Snyder. Does drinking have anything? I mean, when, years ago when you thought about liver disease, you always thought it was, automatically associated with heavy drinking. Is that true? Is that a myth?
So I can answer that question. Before fatty liver was termed MASLD, it was actually called non-alcoholic fatty liver disease. So meaning if you drink alcohol, then you couldn't be diagnosed with non-alcoholic fatty liver disease. In fact, that would be called alcohol fatty liver disease. But to answer your question about alcohol affecting the liver, yes, it does affect the liver. But usually that's a different disease than what we see in MASLD. I just wanted to add to the alcohol because alcohol can be part of many people's lifestyle. So having a sedentary lifestyle is definitely a risk factor for MASLD. You might ask, what does a sedentary lifestyle mean? Well, that usually means people who do not have a healthy diet and people who do not exercise routinely. They can develop weight and it can affect the liver because of the extra fat that is in the liver.
Okay, and I guess the way I look at sedentary, sometimes people may go from their car to the garage to work, into work, back to the back to their car, back to home, and never really get any exercise um, in between. Um, okay, moving on. Besides the liver, Dr. Talal, does this disease affect any other organ or organs in the body?
Yes, it's really a syndrome, meaning that it affects many different organs. But the biggest ones to be concerned about are besides the liver, are diabetes, the high blood pressure, high cholesterol, and obesity. And so some of the other organs, those are the other entities that can be associated with MASLD. But really, the other organs to be thinking about most commonly would be the heart, the kidneys, the skin, and the pancreas. And so those would be the ones that we routinely check when we follow patients up who might have MASLD.
Mhm. Dr. Daria, how would a listener know if they have MASLD, formerly known as fatty liver disease?
Can I take the introduction to that question?
Sure,
Because
of course.
I'd like to
Yes.
repeat what happened to me yesterday. I was at the gym
Mm-hmm.
and somebody came up to me and said, "You cured my hepatitis C 10 years ago. I'm wondering now, how do I know if I have fatty liver?" And so my answer to him was, we have a very good test for you nowadays called FibroScan, and I'm happy to turn the floor over to Dr. Daria to tell you more about the FibroScan.
Thank you, Dr. Toal. So we have the FibroScan at University of Buffalo, and this FibroScan can measure the fat content as well as the scarring that's in the liver. It's basically a modified version of an ultrasound, and it uses sound waves to assess the liver. It is completely painless and non-invasive. The only preparation is fasting for 3 hours prior to the exam. It can be done in almost everybody, except those with morbid obesity or fluid in the belly. Also, if you have a cardiac pacemaker, then you should not have a FibroScan exam. Another way to find out if you may have MASLD is by liver enzyme test. So we have liver enzymes, and if they are elevated more than normal, these can be discussed with your primary care doctor and possibly refer to a FibroScan. Another way is an ultrasound, because ultrasound can actually look for liver cancer in people who have cirrhosis, but it cannot reliably look for fat and scarring in the liver. That's why a FibroScan is preferred over an ultrasound. Lastly, there is another test called the liver biopsy. And the liver biopsy, basically, we take a sample of tissue from the liver and we look at it under a microscope. And this remains the most accurate test. It is, in fact, the gold standard for diagnosing MASLD. And it does have some risk and pain associated, whereas the FibroScan is risk-free and completely painless. I also wanted to say that there is a more severe, more progressive form of MASLD, and it is called MASH, M-A-S-H, and this stands for Metabolic Dysfunction Associated Steatohepatitis. Steatohepatitis means inflammation of the liver in association with high fat in the liver cells. Now, the difference between MASH and MASLD is that people who are younger and typically have a normal BMI and they have a healthy lifestyle with diet and exercise, they can still be affected by MASH because it plays more of a genetic role.
Francesca,
Yes.
I'm gonna jump in here for a minute because I think if there's one thing I want our listeners to understand, it's how complex this organ is and how blessed we are to have the specialists that we have in this area.
Absolutely.
We had mentioned that Dr. Talal was recently awarded one of the top 3 awards in the nation around research from Corey Grant around his work in this area. I think the reason this show is so important isn't that the community needs to know this information. The community needs to know this. There are things that we can reverse, and there are things that we can do to reverse things. Once the liver is damaged beyond a point, it becomes extremely complex for that individual because we don't necessarily have the ability to reverse and fix this organ. And what we talked about last week the last show leading into this show, this is why the state mandate of the screening for viral hepatitis and its impact on the organ long term, because people just wouldn't know they had it until sometimes it's too late, or the ability to get comprehensive metabolic profiles with their primary care doctor and assess and check for liver function and liver disease, and then getting into the hands of these specialists. So the real message to this group is we have some of the worldwide best expertise in our community on this organ, and the community needs to understand that part of the syndromes of metabolic disease that affect our whole body, high blood pressure, diabetes, hypertension, our diet, and sedentary lifestyle can have silent effects on this organ as well. And we need to have an awareness of that.
Absolutely. I mean, and I want to say that, we are doing the show. It is Juneteenth Saturday. And I know if you are concerned like I am, just listening to today's show, if you're at Juneteenth today, between the hours of 10 a.m. and 4 p.m., please stop by the Health Pavilion if you don't have a primary care, because our Kaleida Health Elmwood clinic will be there. And if you need a primary care, if you need to begin to get all of this information sorted and you need to get screened, please stop by the Health Pavilion and visit one of our staff from the Elmwood Medical Clinic. And I know they are taking new patients, so I just had to throw that in there. If someone's listening to the show and they're feeling concerned that they just want to get checked up. So thank you. But back to prevention, back to what Dr. Snyder was talking about prevention. Um, how would the listener know? Um, what should they do? Is this a typical, and I know we talked about, you just mentioned New York State mandates, but is this something that when you're a certain age, is it a blood test? Is it a certain age at which it has to be done by this test has to be done by by your primary care, checking at your liver and different complications? How would the person in the community know to ask to have this and make sure this is being covered?
So I'll handle that, Dr. Talal. Thank you very much, Francesca, for the question, and thank you for the announcement. It's very of the upcoming primary care opportunities to engage with primary care, because that's very important. In terms of knowing if one has the infection, one has the MASLD or MASH, that's one of the reasons that we wanted to do the show with you today, was because it is important that the public have awareness of this entity. And usually there is no one test like viral hepatitis, like exists for viral hepatitis, that can be done to diagnose MASH or MASLD. So usually it's because somebody has an ultrasound and there's a notation of fat on the ultrasound, or they have elevated liver enzymes, and those two are the primary ways in which the disease will be diagnosed. Another way is by in certain high-risk populations. So we already mentioned a gene that exists in individuals of Hispanic ethnicity. We also have noted that many diabetics have this disease. It occurs in up to 50% or more of diabetics. And so anybody who has diabetes routinely should be screened with the FibroScan. And in terms of prevention, the most important aspect is following good health practices, eating foods, Mediterranean diet, getting exercise, and exercise really has been shown to reverse, at least in the earlier stages, to reverse the complications of this disease.
Yeah, thank you. And I know that the other day, last week, this past Saturday, at JFK Park here in Buffalo by the old Sheehan Hospital, there was a community outreach for a woman by the name of Gail Wells. But my point is, they were giving out free plants that were vegetable plants, tomatoes, peppers. They had another vegetable. I've never grown vegetables before, but I'm going to try this year. And because a lot of our listeners some of our listeners live in food deserts. So you can also begin to grow some of your own vegetables. Some of them you can grow inside of your house. And there are many community gardens throughout Buffalo, several throughout Buffalo. If you're interested, please give me a call, 716-863-8717. I can share where these community gardens, where you can get maybe for a small fee, but sometimes it's free, fruits and vegetables. So I just had to put that in there. Okay, before we talk about more in the area of prevention, you've mentioned on more than one occasion, fluid in the belly. Don't all stomachs have fluid? What does that mean? Fluid in the belly.
So there's a particular problem that exists that develops when people have very end-stage liver disease, whether it's due to alcohol, whether it's due to viral hepatitis, as we've discussed, or whether it's due to MAFLD D or MASH, in that the liver cannot produce the proteins that keep the blood in the blood vessels. And so you get leakage of blood, of fluid into body cavities where it shouldn't be. And that can be in the belly and or edema or swelling in the feet. And what we're talking about is really, when I say fluid in the belly, really is massive amounts, liters of fluid that can really become very difficult to manage because people may have to have different approaches to treatment. But this is one of the manifestations of end-stage liver disease.
Yeah, and I know what you mean. I now know it exactly what you mean. So how about is this hereditary? And again, I know I talked about prevention. What are some prevention tips? I know you talked about exercise. Like, is bike riding any better than walking, any better than running? How about all of these sugary drinks that we see advertised? Is that something we need to leave out? I'm just looking at prevention.
Francesca, I'm going to take a start at this and let our colleagues jump in as well.
Okay.
When we have excess calorie, excess carbohydrate that we aren't burning or using, our body stores it, and it stores it anywhere. And if it's not used up in muscle or active muscle tissue where it's needed right away, it can start to go to all of our organs. And that visceral fat can be deadly. And so sometimes actually people that have belly fat can store fat. It might even be safer than in the viscera and in our organ systems, because the fat starts to not allow the organs to work optimally. Dr. Talal mentioned this about the heart, right? So it can be in each organ. So now what we're talking about is excess fat that we are consuming through carbohydrate or other that is not being used, that ultimately is stored for what should be running a marathon or some form of active use, that then is congesting the normal function of the organ. And that's really what we're talking about when we talk about metabolic syndrome and what's leading to the chronic disease throughout our entire community. Dr. Talal or Dr. Daria, if you want to expand.
Sure. I'll say, with regards to exercise, it's been shown quite nicely through several studies on the liver that if somebody loses 5% of their body weight, but through whatever means, bicycling, running, walking, you can actually decrease the inflammation, those cells in the liver that are promoting the scarring. And if you lose up to 10%, at least 10%, you can actually have get decrease in the scarring. And so there's many, many years. It may take up to 20 or 30 years for the end-stage liver disease to develop. So there's plenty of time for people to get involved and to start working with a trainer or with a registered dietitian in order to try and improve their eating and exercise habits.
Yeah, and I was going to say, if you don't have the extra money for a trainer or the extra money for for the other things, I have to say, a couple of years ago for Lent, I gave up sweets, and it took me 2 years. But I would say prayer, because we have a very faith-based audience. Sometimes you just need to pray that when you see that peach cobbler or you see that donut, you just have to pray to a higher being not to eat it, because it's gonna mess you. It really will. It's not good for your system. And I just had to throw that in there. Dr. Daria, and any thoughts on any comments about exercise or getting along prevention? Water, How about water, Dr. Daria? How important is it for people to drink water versus black coffee? And is water important for the system when it comes to massa, formerly fatty liver disease?
Yes, definitely. Drinking water is an important part for the body, just overall, but especially for the liver, and it should be part of a healthy diet. Weight loss is a well-proven prevention approach for MASLD. Loss of 5% of body weight results in decreased inflammation, and loss of 10% body weight can result in decreased scarring in the liver. So just going by those numbers, a little bit can have a tremendous impact.
And does it matter if water has, like, people add like the flavors? I call them flavor crystals. I don't know what's in there, or if it's soda, if it's fizzy water or non-fizzy. Does it matter what kind of water, or because they just do so many things how to mask the flavor of water?
Well, plain water without any additives would be the best. Um, as Dr. Snyder was talking about earlier, soda has a lot of uh, unnecessary carbohydrates and excessive sugars. So this sugar is broken down into glucose and fat that can distribute itself among the body, especially the liver. So, you want to stick to natural water is the best in my opinion.
Mm-hmm. Okay. And
We
how?
also we
Mhm.
recommend the Mediterranean diet because the Mediterranean diet is high in vegetables, high in fruits, and high in legumes. Legumes includes foods such as beans, nuts, mushrooms, and of course, seafood and white meat is very important. Whole grains as well.
How about the people say it doesn't taste good unless it has cheese or a few pads of butter?
I would say everything in moderation.
Okay, that's fair. You know what? We are out of time. And we will be repeating the show at least one other time because the topic is so important and we've covered a lot of information. And I just want to thank you, Dr. Snyder, Dr. Talal, and Dr. Daria for being our guests this morning on the Great Lakes Health Radio program, and the topic, fatty liver disease, and which is the correct term is MASLD. MASLD?
Massel D, excellent.
MASLD. Yes. Thank you. So I just want to thank you. And our time is up. I can't believe it, but it is. So thank you. Next week you'll hear from our host Cindy Bass from ECMC, and in 2 weeks, God be willing, you'll hear from me, Francesca Messiah, Kaleida Health Manager, Workforce Development. Thank you for listening. Bye bye.